I'll start out by introducing myself. I'm Teresa Duong. I'm one of the fourth years, one of the officers in the AWS chapter at UAB, and I applied general surgery this cycle kind of in the middle of interviews. So really glad I finally get to be able to interview one of you great ladies and get to learn all about you. So if you don't mind, just starting out with telling me about yourself and like your title, department, and where you did your training.
No problem. I'm Sasha still. I'm an assistant professor of cardiac surgery here at UAB. And also I'm the division chief cardiac surgery at the Birmingham VA. As for my training, I did medical school at University of Texas Medical Branch at Galveston, and then did general surgery training at Baylor University Medical Center in Dallas. I have to plug them because it was a fantastic general surgery program. And then after that, did traditional cardiothoracic surgery training here at UAB and continued on as the first aortic super fellow here at UAB as well.
Awesome. That sounds great. And then one thing we always like to ask is, can you describe your journey towards pursuing surgery and then cardiothoracic surgery as well?
So I'm sure I've seen some of your other videos. My journey was not a straight path. It's been pretty zigzag. Like many, I know everyone says the same thing, in medical school, it's very difficult to choose what you like. It's like a kid in a candy store. I actually fell in love with urology. And so I really like the people. I like the idea of a surgical subspecialty, and I matched as a urology resident here at UAB. In my first month, I saw a major catastrophe in the trauma ICU. And I realized at that point, seeing how the team worked and, the kind of the patient in extremis and everyone putting their best foot forward and trying to save the patient, that I didn't want to be a surgeon that couldn't handle these types of like very complex and life-threatening issues. And although I loved urology, I felt like my heart of hearts needed something a little bit more, maybe a field a little bit more adrenaline filled. And I wanted to be able to handle those acute issues. So within 6 months, I switched to general surgery, went back to Texas, where I'm from, and completed 5 years in Dallas. At that point, you learn what your passions are. Over time, I was between trauma and abdominal transplant and cardiac surgery. The similarity between all of those is that it's big surgery that can be a bit gruesome at times, but you need to be quick on your feet, you need to be good at what you do, and you need to be able to handle yourself in these kind of high intensity situations. And so what kind of we say when you're a general surgeon trying to figure out what you want to do is, what do you want to come in the middle of the night and do? You don't want to come in the middle of the night. And that's number one. And then you can, choose your field based on that. I was between kind of trauma, vascular, transplant, and cardiac. And at the end of the day, I'd rather come in for a dissection at 2 a.m. than a cold leg or a transplant or some big trauma. And so that's kind of how I decided on cardiac. I thought there was something really special about the non-verbal communication that goes on in the operating room. Yes, it can happen in other types of ORs, other specialties, but it's kind of a beautiful symphony. It's very kind of impressive to witness early on. Also, a cardiac surgeon has a level of control of the room that I hadn't seen before, and I liked that as well, I guess, because I'm a control freak. And then aortic surgery, just like I've said, I really like big, complex, bloody, open procedures, and I want to be able to handle that on my own, ideally without any assistance. And also aortic surgery requires a lot of complex problem solving, as no patient is the same. Specifically with just a dissection, it's a surprise every time. Sometimes a Pandora's box, and I like that element of surprise as well. So here I am.
Yeah, awesome. I feel like you gave a lot of great advice, especially like the what would you like to wake up in the middle of the night for? And then also it's so important to touch on kind of that zigzag path, because I feel like a ton of people are always like, well, it's third year and I'm just now thinking that I like surgery. Is that okay? And so I think it's so important to highlight how you can like want to do something else, but then at the end of the day, still find your passion for surgery. So that's awesome that you did. And now
Yeah, yeah.
you are, I'm sure, a great mentor to a lot of the students at UAB too. So my next question is, I'm sure you've had challenges as a woman in the field of surgery. So could you touch on some of those and how you overcame them?
So I read that question and I've thought about it multiple times during my training, and I really feel like the challenges, any challenge that I've had to deal with in surgery mirrors challenges of my male counterparts. I don't feel like I have had any challenges that are specifically related to my gender.
Mhm. Awesome. That's great. And I feel like I'm going a little bit off script here, but one thing that I think I'm struggling with now and will be struggling with in the future is imposter syndrome. So
My
could you,
specialty.
yeah, no. So have you ever like experienced that, struggled with it? And do you have any advice for overcoming it?
So I am a expert in imposter syndrome, and so I mean I'm still honestly, frankly, I'm still working through it.
Mhm.
My mentor is a very busy, maybe the busiest heart surgeon in the country, and my boss. And every day I strive to be as good as he is and better. And it is a daunting task, especially when you're reflecting on yourself and trying to mimic someone else's achievements, both in and out of the operating room. But all I do is I'm sure exactly what you do early on is you just put your head down, you keep doing the best you can every day, and you try to be better than you were yesterday. And part of that, I think, is also obtaining objective data on yourself and working to be better. So whether that's you practicing suturing at home, timing yourself, seeing how many anastomoses you can do, for example, or if it's documenting how fast it takes you to do a hernia, or close a 6 centimeter skin incision. I think trying to beat yourself is how you end up dealing with the imposter syndrome, because at the end of the day, I mean, you're your worst enemy, you're your worst critic. And so I guess just keep trying to be better.
Yeah, no, I love that. I feel like that's one of the reasons why I love surgery so much, is that there are so many ways to learn and improve throughout your career with your medical knowledge and then research and then your operative skills. So that's awesome. That's great advice. Moving on to more fun questions. So I'm sure you have a life outside of the hospital. What do you like to do outside of work, and how do you balance your professional life and your personal life and social life?
So I try to have a life out of the hospital. As a junior attending, and you will come to see this, it's much different from being a medical student, resident, fellow, super fellow. You have this extraordinary gift to take care of and be responsible for patients' lives. And so it's been difficult trying to deal with that, for example, after I leave work, because all my patients are always on my mind constantly. So to deal with that, I exercise a lot. I love to run and go to the climbing gym. In terms of just what I do for myself, I love being outdoors, disc golf, fishing if I can, sitting in the sun, and shopping for shoes. So that's like on a personal selfish note. Otherwise, I have a fantastic husband, and I have a 4-year-old. He just turned 4 on Sunday. And so spending time with them is how I kind of get out of my, it gives me respite from the day, whether the day's good or bad. It's my balancing force.
Awesome. Well, happy late birthday to your son, first of all.
Thanks.
But you mentioned shopping for shoes. So I was going to ask you, what are your go-to shoes for kind of just like a day on the wards?
So like, okay, so obviously I'm in scrubs, so that's my Dansko thing. But for clinic, I'm a red bottom.
I love it. I love it. You got to have a balance, right?
Yeah, so I balance my foot pain in the Danskos with the foot pain in the Louboutins. It's perfect. But you know, you got to do something for you, and it's not just about I know males have something that they like to, that you know, takes them out of the workspace. We're here every day. I come in very often on the weekends when I'm not on call, just to see my patients, and it's a fun thing that I like to do. And you know, just because I'm in the trenches doesn't mean I can't you know, have some nice footwear.
Exactly. All right. And then my last question to you is, and I'm sure this is something I'm going to be struggling with in training, what's your favorite snacks for in between the OR and just kind of even throughout residency? I know it will be hard to eat real meals. So kind of what you did during that time and what are your favorite snacks now between the OR?
Peanut butter and jelly sandwich on Nature's Way, I think honey wheat with Jif extra crunchy peanut butter and a Bon Maman jelly, preferably raspberry.
Okay.
I
Awesome.
eat a peanut butter and jelly sandwich every single day.
I'm like very